Hey guys, thank you for coming today. We're going to be teaching you a little bit about sleep, the importance of getting enough, and some benefits and risks for not doing that.
Okay, so sleep, why is it important? Here's just like an overview. Sleep is very important in maintaining optimal physical and mental health. Sleep is necessary in order for the body and mind to function appropriately. Many different aspects can be impacted by lack of sleep, such as academic performance, mood, social life, and mental capacity. And it's also very common in college for academic requirements and social obligations to inhibit the amount of sleep that college students get. So according to Healthy People 2020, the percentage of people in the US who get less than 6 hours of sleep per night has significantly increased over the past 30 years. College students in particular struggle balancing sleep schedules, employment, school, and lifestyle. Less sleep due to lifestyle choices is associated with higher rates of fatigue, disorientation, and decreased alertness. So why college students? 25% of adults report insufficient sleep at least 15 out of every 30 days. 48% of college students report having some type of sleeping difficulty, most commonly lack of sleep.
Okay, and why does it matter? The CDC has actually shown that college students suffer from illnesses related to lack of sleep, such as diabetes, cardiovascular disease, obesity, and depression. Also, further research has shown that college students report 3 days out of the week that they feel dragged, tired, and sleepy. These negative feelings can result in impairment in attention, mood, memory, performance, and even safety. Some consequences can be lower GPAs, increased risk of failure, car accidents due to drowsy driving, and depression. It is also shown that college students at a large university have terrible sleeping patterns. They utilize the Pittsburgh Sleep Quality Index to assess sleep quality. Any score greater than 5 indicates poor sleep quality. The results that they conducted from the study showed that at a large university, men had the average score of 6.38, women had an average score of 6.69, and both are well over the poor quality sleep markers. Further research showed that promoting sleep in college students and increasing other health promotion behaviors leads to an increase in their cognitive ability and academic performance, which resulted in higher grades and GPAs. When a person gets an adequate amount of sleep, the neural synapses in the brain strengthens, resulting in cognitive benefits.
A lot of studies have shown that there's been an increase in all-nighters among all college students. Studies have shown that sleep during the young adult years is shortened, leading to daytime dysfunction and health problems such as anxiety, depression, and somatic symptoms. With the increase in all-nighters, there's also an increase in anxiety and depression within the first semester of college, which correlated to a decreased sleep. The transition from high school to college is a large stressor due to the changes in family dynamics, more responsibilities, increased independence, and increased academic demands. There is an increased need for teaching among college-age students due to the fact that there's poor sleep schedules, sleep schedules correlate with negative outcomes, such as lower academic performances, increased rates of health and emotional problems, development of chronic sleep disorders, and research supports that as sleep quality decreases, risky behaviors increase, such as stress, alcohol, and cigarette use. So how much sleep do I need? Usually, teens need around 9 to 10 hours a night, and adult needs are around 7 to 8 hours. About naps. According to the National Institute of Health, naps are a way to improve alertness and performance for a short period of time. However, napping does not provide your body with all of the necessary benefits of actual sleep. You cannot actually make up for lost sleep.
Okay, so reasons for inadequate sleep hygiene can include like alcohol, caffeine and energy drinks, stimulants, use of technology prior to bed, and late night socializing, and all of these can have negative impacts on your sleep quality. So sleep hygiene is promotion of regular sleep, and this can be done in a number of ways. Some tips are like going to bed at the same time each night and waking up at the same time each morning, sleeping in a dark, quiet, relaxing environment, making your bed comfortable and using it only for sleeping, so not reading, watching TV, listening to music, stuff like that, removing all TVs, computers, and gadgets from the bedroom, and avoiding large meals before bedtime. And all of these can promote good quality sleep. According to Healthy People 2020, poor sleep health is a common problem, with 25% of U.S. adults reporting insufficient sleep or rest at least 15 out of every 30 days. And then it says, why is sleep health important? Sleep, like nutrition and physical activity, is a critical determinant of health and well-being. Sleep loss and untreated sleep disorders influence basic patterns of behavior that negatively affect family and interpersonal relationships. And then fatigue and sleepiness can reduce productivity and increase the chance for mishaps like medical errors in motor vehicle or industrial accidents. And adequate sleep is necessary to fight off infection, support the metabolism of sugar to prevent diabetes, perform well in school, and then work effectively and safely.
Some benefits to getting an adequate amount of sleep. It'll help to improve your memory. You have a longer life expectancy. It'll decrease inflammation, increase creativity. It'll promote better grades, sharpen your attention. It'll help you have a healthier weight. It'll decrease stress, and you'll be able to avoid accidents because you won't be so tired. Some consequences to having a lack of sleep are accidental death, yawning, impaired brain activity, cognitive dysfunction, memory problems, moodiness, hallucinations, depression, heart disease, type 2 diabetes, high blood pressure, cold and flu, and a weakened immune system. So getting enough sleep is really important. That's all I got for you guys. Thank you.